we should inform our viewers that a potential deal, a more than $1 trillion stimulus package that we thought was coming together, there was going to be a procedural vote. At this point, it seems as though no deal tonight.
Over the weekend, I've been speaking to business leaders, banking executives who said it sounds like things are getting closer and closer. They're in close contact with Secretary Mnuchin. But the fact that no deal happened tonight, that's devastating for individuals, small and big businesses alike. So let's start with individuals. The president said right there how much he cares about the American people. This is obviously not their fault, and they'll be getting checks. We've heard the proposal from the White House, $1,200 to people who make up to $75,000. But without a deal, they're not going to be getting that. As far as small businesses goes, they have extended small business loans to include even more businesses, a bigger number. But think about the logistics. These are loans. They're not grants. We're 1 week away from credit cards being due, from rent having to be paid. Small businesses are any businesses with 500 people or less. So yes, there's more availability for loans, but we don't know what are getting passed or the logistics to get any of this money to those companies. And now the third leg would be big business. So publicly traded companies. I invite you to look at Dow futures. They're down over 900 already. And he still is saying select businesses, right? He mentioned there the cruise industry. He said how important it was economically, specifically to Florida, and what a big employer that was. But I invite you to look. The three largest cruise lines are not registered in the United States. They're registered in Liberia, Panama, and Bermuda. There's not enough details in what these bailout packages will be. And one of the gripes in 2008 where banks were bailed out and it worked out for executives and stock buybacks happened, but it didn't trickle down. Now, the president mentioned he didn't want to see stock buybacks, but again, we just don't know the details. And the fact that we don't have details and no deal signed, that means no money's going through.
And we're joined now live by U.S. Surgeon General Dr. Jerome Adams.
I want America to understand this week it's going to get bad. Young people out on beaches. We see here in D.C. That the district set up a cam for people to watch the cherry blossoms. You look on the cam, you see more people walking around than you see cherry blossoms. I think that there are a lot of people who are doing the right things, but I think that, unfortunately, we're finding out a lot of people think this can't happen to them. When you look at what's going on in New York, and we said this at the beginning of our 15 Days to Stop the Spread initiative, that the numbers you see reflect what happened 2 weeks ago. We don't want Dallas or New Orleans or Chicago to turn into the next New York, and it means everyone needs to be taking the right steps right now, and that means stay at home.
Yeah. The president tweeted just last night around midnight, and he said, and I can put it up on the screen, "We cannot let the cure be worse than the disease. At the end of the 15-day period, we will decide which way we want to go." What does that mean?
Our 15 Days to Stop the Spread initiative really was based on the fact that when it came out a week ago, we were about 2 weeks behind Italy, and we really hoped to instill a sense of urgency across America. That includes pulling down elective surgery cases, and I have a op-ed about that. That includes our social distancing measures. Stay at home. Don't take any unnecessary travel. Avoid groups of larger than 10. That includes not teleworking. And again, there are parts of the country that are doing it. But these mitigation measures work preventatively. They work best the earlier you do them, and people are still reacting and waiting to see spread. Right. As the nation's doctor, I'm here to help America understand how we need to respond to this. And where I come down is that every single day counts. Every single second counts. And right now, there are not enough people out there who are taking this seriously, and you just see it looking in California, people on the beaches.
If we're not testing as much as we could be, how will we know? I mean, what's your progress report on where we are on flattening the curve when you have places like New York State saying, we're not testing you anymore unless you come in here to the hospital? So if you're not testing, how will we know if these measures are working?
I had a tweet out yesterday where I pointed out last week, if you look at Monday to Friday, testing increased by tenfold. Testing is definitely significantly increased across the country. We need to make sure we're prioritizing testing for our healthcare workers. We need to take care of the people who take care of the people, for people in hospitals, and for people who are at highest risk right now. So test or no test, we need you to understand you could be spreading it to someone else, or you could be getting it from someone else. We're not going to ventilate our way out of this problem. We're not going to treat our way out of this problem. The way you stop the spread of an infectious disease like this is with mitigation measures and preventing people from getting it in the first place. And so while we are focusing on supply, we also need to focus on driving down demand this week. We need more people talking about, hey, stay at home.